Hey everybody, we're here live with the Psyche Truth channel. I'm really anxious to talk with you today. I'm Robert Gardner. I'm sure you've seen me on some of the Psyche Truth videos we've done over time. I'd be happy to chat with you guys. If you go ahead and write down below, you can ask any questions that you have. I'm happy to chat with you. My main specialty, sort of area of expertise, is within the fields of massage and yoga. I've really kind of hybridized both of those. And if you followed the Psyche Truth channel over time, you might have seen a little bit of that progression and development. Hey, more of MCB. Hey, Sajida. I had a chance to really document, sort of in the same way, what I've done with my practice on the Psyche Truth channel in video. You got to see me start out with like table, cream, glide, and nudity, kind of progressing to table tie, then a little bit of mat work, and then a little bit more yoga instruction, hands-on assists. If you guys have any questions about massage or yoga, I'm happy to chat with you about that. So yeah, we get a chance to hang out. Really excited to do this. I hope that you guys have lots of questions that I can answer for you and give you just some basic information. I wanted you to know that if you want to follow me, let me see here if I can find some information. I've got these social media channels I may occasionally promote just so you can follow me on other channels. Hey, Barona. Hey, Lone Star Wolf. How you doing? If you guys have specific questions, please just ask. I'm happy to chat with you. I love being able to engage with fans and give you more information. If you guys are on Instagram, in addition to what you're watching, you can always follow me at Robert G Wellness 12. Again, on Instagram, that's Robert G Wellness 12. Feel free to follow me on those channels. If you want to look me up on other channels like, Facebook, Robert Gardner Wellness, things like that, you should be able to find me. I've got my own YouTube channel as well. Ooh, Colleen. Colleen's asking the first question about vertigo. Colleen, vertigo can be really complex, and massage therapists don't really diagnose or treat conditions, but I can give you a little bit of information about what I understand about the condition. So in the inside of the ear, the parts, the anvil, the this, the that, people can have problems in their inner ear related to liquid that's like balance. I really recommend that you go see a medical professional and get more succinct information from them. Vertigo, when you're dealing with yoga, is even more challenging because when you're changing position in space, you're going to put your body under more stress and strain if you're having vertigo, I mean. You're also going to want to be careful about your balance because you don't want to fall out of certain poses and hurt yourself. Vertigo is one of those things. I've heard people talk about craniosacral therapy helping when it comes to body work and massage. I've heard of people, recommending treatments from other, from other factors, from things like other kinds of modalities like Ayurvedic massage, things like that. I don't know that there's been a lot of scientific research on vertigo, and because it's not my area of expertise, I don't know where to tell people to go. That's why I always recommend out or refer out to medical practitioners and doctors, because the reason somebody's having vertigo could be wildly different. Even though it's showing up as a specific condition, there may be other neurological or other issues, so I really recommend you talk to a doctor. So, Chris, when you're asking about Thai massage and going to Thailand, I have quick recommendations for you. Mr. Pichet Buntum, if you see this, I personally, and this is me, if I had a chance to go to Thailand, I would probably go almost directly outside of Chiang Mai into Hang Dong and go see Pichet Buntum. He's generally considered the master of Thai massage who's living right now. And I have enough background and expertise that I could learn more by working with him and hanging out. I think the other part, Chris, about going to Thailand is you're going to get more information about the culture, the cultural context that Thai massage grew up in. You're going to be able to network with people in that culture to see how the work is being practiced. You're going to be able to receive massage very inexpensively. So that's probably where I would go. A lot of people go to ITM, the International Training Massage Center, something like that. People also go to the Old Medicine Hospital and go to those specific schools to study, although there are certainly others. Those are the ones that I know of as a Thai massage practitioner. What I do notice as an educator in America is a lot of Thai massage that I'm teaching is very rudimentary. It's very basic to get massage therapists to understand mat-based work. And then I'm giving them more information about packaging, marketing, and putting it together for a Western audience, because Thai massage is slightly different than what consumers are used to receiving with table, cream, glide, and nudity. My work very specifically takes away table, cream, glide, and nudity. So that would be my recommendation, Chris. If you have any other thoughts about that, feel free to let me know. So Mickey Pure, when you're asking about being able to crack your back at will, I think you're just creating space in facet joints along the spine. I think so long as it's not painful, there's totally nothing wrong with that, and it seems to happen to everybody. You can take a yoga class, do a little side to side in your lumbar spine. It's very common for people to feel that little bit of crack. When you ask about does massage help your legs get better from injuries, what I do think happens is you're having a positive effect on someone's nervous system. You're having what they would call in the biopsychosocial model. Essentially, you're having good interaction with other people. That includes touch. Our primate ancestors would spend tons of time cleaning and grooming. And part of that is the social construct of being able to engage in touch. In addition to that, there may be some research behind the fact that when you're working on muscles, that you're able to maybe temporarily increase blood flow to an area to help with old injuries. It also depends on what that injury is. If you have a pull, a strain, that's a little bit different than working out excessively and having a little bit of muscular soreness. So Maria Hernandez, you're asking about how do you begin doing yoga? Maria, I don't know where you live. One of the things I would recommend if you have a chance is if you can find a local yoga studio, I want you to ask questions of the local yoga teachers, and I want you to interview them. And what that means is it could be 5 minutes on the phone. You're just going to ask them questions about what they teach, why they teach it. I want you to find who you connect with. I think when you develop social connections with yoga teachers, it's going to be a bit easier to justify going to the class, because yoga in America is not just an isolated pursuit, it's actually a pursuit of social skills. What it means is if you develop friends at the yoga studio, you're sort of working with them in an ongoing way to work on your practice. It also just depends on what you resonate with. There are many different styles of yoga. So something like yin, that may be very relaxing and slow or restorative. Maybe you're not interested in that. Maybe you want something like hot yoga or something that's more athletic like Ashtanga. It depends on where you are, and it depends on what you connect with. So Maria, since you're in Chicago, you have tons of instructors in that area. I would do some research online. Like I said, definitely interview some local teachers and find out what you like. Ooh, let's see. Where is my friend and colleague in Chicago? What is the name? Give me a second on that, Maria. I have somebody I might recommend to you, but I'm trying to figure out if I can recall his name. I would have to pull that up. So Annabelle, when you're asking about music for a yoga class, I think that you can stream on Spotify and pick out different music that you like. It also, again, depends on the kind of yoga that you're doing, meaning if you want something that's really upbeat, if you want something that's more traditional, maybe like kirtan, there are lots of different options, and we have so much audio capacity for streaming. There's a lot of stuff that you can choose from. So Melissa Worley, when you're asking about yoga for like nerve damage in the neck, This is where, again, massage therapists don't diagnose or treat conditions. I would, one, get a doctor's release, but beyond that, do you know what kind of nerve damage have you had? Are you having like a bulge? Are you having herniations? What kind of issues are you having? One, you get a doctor's release. You can ask the doctor about physical therapy. You can ask them about yoga and what you think is safe. It's really difficult unless you give me more information for me to say actually how you would deal with that. Jacqueline, when you're asking about beginners yoga videos, I think you'd do better potentially to watch mine starting off on the Psyche Truth channel. I have a tendency to work towards beginners, people who don't necessarily know a lot to get started, and I know my work is being a bit more gentle, so you might want to start with that. A lot of people, you might want to look at something like restorative or yin yoga initially. So Jennifer Page, where are you in the country when you're asking about massage therapy certification programs? And let me see if I can find that information on the Chicago yoga teacher, because I think he's in here. Aha. So here's what I want you to do. I want you to look up John Sweeney. John is a friend and colleague in Chicago. He runs a yoga studio in the Chicago area. And John Sweeney, if I could look him up, you're probably going to find him on a Google search. John Sweeney is running the yoga studio. He has a particular focus on yin yoga as far as the content I discussed with him. He took a Thai massage class with me. I was really happy to connect with John. I was in St. Louis at the time, but he came down from Chicago. I would recommend connecting with John. If John Sweeney, if he doesn't teach the kind of yoga you're looking for, he should be able to connect you with someone who is. He would be my contact in Chicago. Okay, Jennifer, Vermont is interesting. When you're asking about massage therapy training programs, Vermont doesn't have licensure for massage therapy. I don't know what schools exist in the Vermont area. I think Burlington, if I remember correctly, is the largest city. So there's probably a school in Burlington. I'm not sure what else is going on in Vermont and then up on the East Coast. The last student I had was, I think, from Connecticut. That was up near the East Coast area, New England. So I would just do research. It also depends on what state you're going to work in, because when you mention Vermont, that's one thing. When you mention Florida, Florida has... one, it's a larger state. You're going to have more massage schools. Florida has very tense regulation. And I want you to consider this, Jennifer. Let's say you spend half your time in Vermont, half your time in Florida. In Vermont, you're not going to have any issues because there's no regulation to deal with. There's no licensure. In Florida, there's really intense regulation. So wherever you go to school, you're going to have to make sure that the school fulfills the requirements for where you want to practice. And if you're working in multiple states, you're going to have multiple licenses to be able to work in those states legally, depending on their legal requirements. Most schools, let's say here in Texas, you have to have 500 hours. Most schools are just giving people enough information to give them those 500 hours so that they've got core curriculum out of the way. Then you'd wind up studying with somebody like me for continuing education. Okay, Melissa, you were asking me about the problems at C4, C5, if I remember correctly. Those are coming from and creating the carpal tunnel issues that you're having. If you can answer me, that'll give me a little bit more information. I might be able to discuss that. And by the way, if John Sweeney, if you see this, hey man, thanks. So when you talk about how massage helps your body, primarily what I think massage does is it allows people to connect socially. If you think about children and babies being able to receive touch It does various things to put input into our nervous system to make us feel calm and relaxed. Even if you're not having a very specific issue, most people just benefit from doing massage or things like yoga regularly. With massage, it's particularly physical contact. The physical contact is really medicinal for people. It really helps them with anxiety, with pain. It's also one of the reasons that I think things like snuggle therapy have started to crop up in the United States because there's such a demand for touch. So, Melissa, if you're having problems with carpal tunnel and those issues are coming from C4, C5, in your lower cervical spine, C5, C4, you have 7 cervical vertebrae, C1 to C7. If you're having some sort of problem with a bulge or herniation, and it's impinging on those nerves and it's running down to your arms, one, I would want to talk to a doctor. And the reason I'd want to talk to a doctor is to find out, I hate to say surgery, but it just depends on what is actually going on and how impinged it is. I'll work with a lot of people, and I'm going to give you something, Melissa, that I think you can do at home that I think is fairly easy to do. I'm going to turn just to the side of the camera right here. Normally what I would do is I put my head against a wall or I lay down on my back, Melissa. I'm going to do this thing where I'm going to create a double chin by retracting my neck. What that's doing is back bending your cervical spine. I'm trying to open up the front and try to essentially push the disc, if you want to call it that, the annulus, the nucleus, like forward. And a lot of people who are having problems, even if they already have a herniation or a bulge, what happens when they do this and hold, or do it in sets of 10, is you're going to strengthen the muscles that prevent you from protraction, I think is what it's called. This is retraction, pulling back. Some people will find that that will help in and of itself. So you could try that and see if it helps. Melissa, if you're having an ongoing problem, you're saying carpal tunnel syndrome, 9 times out of 10 when people talk about carpal tunnel syndrome, I'm going to want to check their hands and arms and work my way back into their neck. If it's coming primarily from the neck, I think that's really concerning. It's something that I would address with a doctor because I want to make sure that you're not having some other issue. And if the pain is bad enough, 10's hospital, 0's no pain, depending where you are on a pain scale, that's when a doctor is going to recommend something like physical therapy or that potentially a surgery. If those nerves are being pressed on and impinged enough, you're not going to want to be able to live with that for another, 50 years. So that's something a doctor should check out. So Barona RB, when you talk about the best exercise to improve breathing, in yoga, there's this thing called pranayama. Wim Hof, the Iceman. Hey, Wim, if you're out there, contact me, man. We need to hang out. Wim Hof teaches breathing exercises as part of his regimen with ice baths. When you talk about improving breathing, my first thought is you're going to work with breathing, which is pranayama. It's exploration and practice. And what that means is your diaphragm and your intercostals are muscles that promote respiration. When you have a strong, supple diaphragm, when you have strong intercostals, that's going to allow you to breathe more effectively. What they tend to do in yoga is they put you in a difficult, challenging yoga pose and then say, breathe. And it's challenging because you're putting pressure on the ribs, you're resisting, so you're strengthening the muscles of respiration. Pranayama could just be called breathing exercises. When you deal with breathing, you're really dealing with neuro hacking. To make a long story short, it's right. Wim Hof talks about it. It's why most spiritual traditions and also martial arts traditions from the East talk about breathing excessively, is because you're able to work with a passive part of your nervous system and an active part of your nervous system. The breathing is the way in. I can, at will, I was talking with people recently, I started taking some CBD drops that have helped me a little bit with anxiety, which I don't think I have a lot of anxiety, but I noticed I'm just more relaxed from taking the CBD. There's a reason I became a massage therapist and a yoga teacher. I need to relax. I have issues with anxiety. And what pranayama and breathing exercises do is it allows me at will, if I focus, I can lower my blood pressure and I can lower my heart rate because I'm inducing calm and relaxation by using my breathing as the handle. Once you begin using that handle, what you start to lead into is what I think of as a practice of yoga or meditation. I tend to tell people that it's neuro hacking because that's what it is. You're accessing your nervous system. What you're going to be able to do is you're going to be able to use skeletal muscle, which is the muscle tissue that you can control, to begin accessing functions in your nervous system that people think you don't normally have access to. You can't slow your heart rate, but you can focus on your breathing and your heart rate will change. You can't really, change your anxiety. But you can breathe a certain way and induce calm. Does it make sense? You can't really, think and control blood pressure, but if you breathe a certain way, you have a handle to begin accessing those other parts of your nervous system. I think that the way you increase that is just through practice. And in Wim Hof's case, Wim will put people in ice baths. That would be really challenging for me. I'm really interested in it because Wim went the opposite direction. I really liked Bikram yoga, hot yoga, because you put me in a hot room, you make me sweat, you put me under pressure. And when you put me under pressure, what I had to do was I had to relax. I had to remain calm. I had to breathe. And what I could do is slow down my racing heart. Wim goes in the opposite direction and puts people in cold. He says that there's additional benefits to people's nervous system. I see people talking about brown fat and a lot of different stuff neurologically and physically. One of the good things about Wim is he has brought more attention. Wim Hof, the Iceman, he's brought more attention to the fact that people have more access to their nervous system than they think, and it's actually encouraged research into that area. But when it comes to breathing, also in yoga, what you're going to do, Barona Arby, is you can prop and position yourself in different ways. So if my shoulders are rolled down and forward, this is closing my rib cage. It means that I breathe more shallow. I tend to be more anxious, just as a general, thing. What I tend to do is put people in a back bend. I can put people in a foam roller. I can put pillows, props, bolsters down so that their chest is open. And what this means is I've created more space in my rib cage for my lungs to expand. What that means is I'm able to regulate the amount of oxygen and carbon dioxide in my bloodstream naturally in a way that feels better. Being able to do that is how you're going to work with your breathing. It's exercise. Okay, Empress Jackieemma, I think I'm saying it correctly. Empress Jackieemma. When you talk about water retention in the knee, I have no idea what's going on with your knee. I'm going to give you a quick, simple, easy way to potentially address it. Now, I have said before, massage therapy does not diagnose or treat any condition. I have no idea why you have water on your knee. I don't know what's going on. I'm going to give you a quick go-to. What I want you to do is I want you to lay down on your back and put your legs up a wall, so long as it's comfortable. With your legs up a wall, I want you to breathe. I want you to breathe deeply, primarily through your nose. If you decide that you're holding tension in your jaw, I want you to take a big in-breath through the nose and then out the mouth. So, Empress Jackieemma, with that water on the knee, I have no idea why you have that. You need to see a doctor. When you put your legs up a wall, here's what I've seen. I'll give you a quick story of something that happened to me years ago. I worked at a chiropractor's office, and a gentleman came in, really lovely gentleman. He was of Indian ancestry, but he lived in Canada, and he lived in the States. He traveled on planes, really long flights, going to parts of Southeast Asia. And he had a problem where he had flat feet. And his ankles, especially when he was on a plane, I don't know if it was because of a change in barometric pressure, but he would have swelling. I can't really do anything to press on his ankles because it's kind of contraindicated for me to work on that because there's all this swelling and retention. Empress Jackieemma, if I was working with you, I can't really do anything for the knee specifically to press on it because it's got all this fluid retention for reasons I don't know. And I told that client, I said, listen, we've given you the massage. You respond well. I just avoid his ankles. I said, you're not going to quit your job. You're not going to stop flying to Southeast Asia. We got to figure out a way to maintain this. And I said, listen, lay down on your back, put your feet up a wall. I want you to do this for 10 to 15 minutes a day. If you can manage, I want you to do it multiple times a day. I did not see him again for 6 months. And one day he came in. I looked at his feet. They were totally normal. And I said, hey, what happened with your ankles? And he said, listen, I started putting my feet up a wall like you mentioned, and it just completely went away. I'm assuming there's some sort of obstruction in his case when it comes to lymph. What I do know is this. Again, I don't diagnose or treat any condition. Me giving him advice to work on his legs that way is extremely non-invasive. I'm not doing anything that's going to put him in harm's way. He's going to be able to deal with that in a way that helps him, hopefully rapidly, and it also empowers him to work on himself. That's what I'm here to do. I don't know exactly, Empress Jackie Emma, why you're having that swelling. If you continue to have that, I would definitely go see a doctor, but that would be my first recommendation. So, Asma Fatima, when you talk about your back and arm pain, Asma Fatima, when you talk about exercise for your back and your arm pain, what kind of back and arm pain are you having? So go ahead and answer that, but then relax. I'm going to answer your question real quick. So when you're asking about medium pressure for lymphatic drainage and also for medium pressure combined in every session, relax. What you're going to wind up doing is really blending things for that client and communicating with them for better clinical outcomes. Again, we're not treating conditions, but we can in some instances help people with symptoms. So it doesn't mean that whatever issue they're having related to lymph completely goes away, but it doesn't make their quality of life better. The real goal as a massage therapist is to develop your skill set, to have more tools available for the client so that you can go ahead and give them something they can use consistently to be able to work on themselves and make their symptoms better. It doesn't mean that conditions necessarily go away. It just means that we've empowered the person to have options, both seeing us and being able to work on themselves. Dimitri Berger, you were asking about how to block and shield during a session. I get lots of comments about this on Facebook massage groups. What I notice is I think you just get better and better boundaries with people. Some of the stuff they talk about as energetic boundaries, I tend to think of as you get better with practice, which means where do you develop limitations, boundaries, being better with boundaries, better with what you do. You're in a situation where you're able to better enunciate those and I think put those barriers and boundaries in place in such a way so that they're written into your practice. So I'll give you a quick example because I work in the massage industry. I'd see a lot of people, Dimitri, they talk about, what do they do about cancellations? I hear this all the time. Well, one, if I have a client that cancels, my morning is free or my afternoon is free. And the reason that happens is because my sessions are 3 hours long. If that client misses the appointment, it is likely that they're not going to be able to schedule with me for another week. What that starts to do is it develops a strong boundary because they know that they cannot get in with me again if they miss that appointment. What that means is the clients begin to behave differently. They make time for the session, make sure their time is taken care of. They book and schedule in advance. I think that generally, Dimitri, you're going to work on developing infrastructure that allows those parameters to be more set. Also, I think it's a good practice, Dimitri, to just understand what we can help with and what we can't help with. Clients having a problem in their relationship. Well, I mean, I can help you relax, but I can't. In other words, you're developing a sense of what you can do and what you cannot do. If somebody has a physical limitation that I simply cannot deal with, meaning they have a knee problem, I don't know why they're having a knee problem. I can only work the soft tissue around that knee and hope that that's going to be able to help them. Beyond a certain point, I just understand that what I do can only help them to a certain degree. It's why I often refer people on to doctors. If I work on a client, and we're talking about how to block and shield during session, if I'm working on a client, I don't take on their pain and suffering. It's not mine. Half of what I do as a massage therapist is just make people aware of stuff. I don't fix anything, treat anything, cure anything. Yeah. What I do is I say, hey, what's going on with these muscles right here? They feel really tight. It's not a big deal. It's just tight muscles. Everybody's got tight muscles. I was at the Thai Massage Jam last night here in Austin. We have 12 chapters nationally. The Thai Massage Jam, somebody was working on me and they lengthened my quads and they felt kind of tight. There was a section of muscle that was kind of tight. Well, it's just depending on how I used my body. I don't take on people's stuff because I personally, over time, learn at almost 42 years of age. I just don't take things personally. It's not about me. It's about them. You guys have a specific question? So asthma, when you're talking about, exercise for your back and arm pain, I would always want to go back to why are you having back and arm pain and try to figure out how we can address that first. People can have back and arm pain for a host of reasons. When I take CBD and I feel better, I have less pain, a little bit. When I have less pain, is that physical or is it mental? I really think they're both. There's the connection between those two, which means if you're having a problem with your back and arm asthma, Fatima, it depends on why you're having that specifically. I don't know because I would have to work with you to get a better idea. Where massage therapists tend to excel is when it's a soft tissue condition, soft tissue issue. Tight muscles, something's pressing on a nerve. We go in, we work on their piriformis and their gluteals. It no longer presses on their sciatic nerve. They no longer have piriformis syndrome. Yeah. It's not sciatica. They don't have a degeneration of the nerve. That's the sort of thing that we have to educate the public about as massage therapists. And if you guys catch this after the fact and you want to contact me, again, I have my own YouTube channel. You can look up just Robert Gardner or Robert Gardner Wellness. You can contact me through my Facebook page, Robert Gardner Wellness. And if you're on Instagram specifically, I believe it's Robert G Wellness 12. Let me check that just to make sure. Yeah, Robert G Wellness 12 on Instagram if you want to follow me there. I talk with fans regularly. I'm RG Wellness on Snapchat if you want to contact me, have questions after the fact. We're hopefully over time going to do more of these live streams so I can answer your questions and give you information about mainly my area, again, is massage and yoga. I got into a specific niche related to Thai massage and really blending elements of yoga, yoga therapy, pain science, trigger point therapy, myofascial release. I use a suspension system to do double-footed compressions and also abdominal work for people. So asthma, when you said that your pain is interrupted on your spine, I'm not sure what that means. Can you give me more information about that? So GSS 1123, advice for a sprained AC joint. And do we know exactly what the AC joint is? Because I'd have to do a little bit of research just to make sure. Let's pull this guy away, see if I can pull up something on my phone in 2 seconds. Acromioclavicular. I thought you were talking about another joint possibly in your knee, but I wanted to make sure. Is that what you're talking about, GSS 1123? You have a sprained acromioclavicular joint? So your acromion is up here. It's like acropolis. It's at the top, acro, right? That's where we get the word acrobat as well. Acromioclavicular, your clavicle is your collarbone. So it's where they connect right there. I don't have any specific information. As a soft tissue guy, both in massage and yoga, I would wind up working the tissue around that. I think that you can work on it slowly, meaning if you're using your hands and fingers. Do you know, are you having a problem with like your pec minor where it attaches at the coracoid process, pulling the shoulder forward? Any additional information you could give me makes it a little bit easier to answer the question. But even I had to make sure, okay, is AC joint another joint? And where is it located? So a sprain and a strain. If I remember correctly, a sprain relates to the ligaments. A strain relates to pulling the muscle, maybe at the tendon. Two different things, sprain and a strain. They might be treated slightly differently. It gets to a point, GSS 1123, if you're having problems with that in an ongoing way, I would probably see a doctor. If you're having some soft tissue related issue, when you feel it right at the top of the shoulder, there's a lot of different things it could be. Have you seen a doctor that told you that you sprained your AC joint, acromioclavicular joint? Because here's what I have a tendency to do. I move it around. I'm going to work on the muscle and the tissue around it. I'm going to go to Google. I'm going to look up anatomy charts. I'm going to look at the muscles that go from supraspinatus, infraspinatus, subclavius, pec minor, pectoralis, all the muscles that go around the shoulder joint to try to figure out what the issue is. And often if you've overstretched tendon, or you've stretched ligaments, which don't like being stretched, by the way, then you're in a position where do the muscles then try to compensate? So, for instance, I had a whiplash, which led me into massage therapy. It means that the muscles in my neck are trying to compensate for probably ligament laxity along the cervical spine. It's something I will probably always deal with unless they figure out a way to do genetic therapy of some sort to be able to help me with that. So I have a tendency to just work on the muscles around the area. If I saw a doctor, they would basically tell me I'm doing everything I could for it and just to wait until I'm old. And then they might put me on some sort of arthritic medication to be able to help me with inflammation through that area because there was a trauma. But pain management is about managing the pain. It means that information is power. It means that I'm able to work on myself in a way that allows me to have integrity. It allows me to manage my pain. Yeah, GSS 1123, I would definitely, if you get a chance, I would definitely see a doctor. I'll always ask people, GSS, you can answer me this in the chat. If 10 is the hospital and 0 is no pain, what's your pain level? Give me a number. So relax. You're in Brazil. Your client has a food intake issue. I want you to go to the Psyche Truth channel. I want you to search for abdominal massage and find the video that I did with Melissa Lemunyon. I did a video with her where I oiled her belly and I made small circles around her navel that progressively got larger. And I worked around her pelvic bowl and then I worked up around her rib cage. When I got into the lower right quadrant, I was applying very little pressure. She grabbed my hand at one point. And the reason she grabbed my hand is because it was so painful. What I want you to do, relax, is I want you to feel safe doing this. I don't know laws and rules in Brazil in relation to massage, but I think if you become familiar with rectus abdominis, if you become familiar with the musculature around the abdomen, you're going to slowly soften that, and then you're going to slowly sink in deeper and deeper. Relax. I'm going to show you how you're going to use your hands to save them. I want you to apply some pressure, but you're going to use the side of your hand and then your fingers to reinforce. It's going to look like this. But you're going to sink in with both. And you're going to press down into their abdomen safely. comfortably, cautiously, with communication. And as they breathe, each time they exhale, they're going to let go and release just a little bit deeper. I think it is safe in most cases, unless somebody has a severe medical issue, to receive abdominal work to maybe help them relax. Can you give me more information about where they're feeling pain? So GSS 1123, the fact that the pain was at a 6 and it's dropped down to a 2.5 or a 3 is good. Are you taking any anti-inflammatory medication like over-the-counter stuff? Usually there's a correlation between inflammation and pain. One of the things that most people will do, myself included, if I have a really bad day, I take a couple of naproxen sodium. Aleve is the brand name, but naproxen sodium is the generic. Those NSAIDs, non-steroidal anti-inflammatory drugs, really help me when I'm having a bad day. I just try not to take them all the time. Yeah, GSS 1123. I think if you go ahead and just continue exploring the musculature around the shoulder, I want you to see if you can find any areas that are tense, tight, or tender that might be influencing that. If you had a strain, which if I remember correctly, a strain, I get strain and sprain confused. One is the tendon, I believe, and the other is the ligament. I just don't want you to develop any soft tissue issues around that, so you might just want to be able to address the muscle around it and see if that minimizes it. Relax. When they have pain on their right side, when her right side is bothering her, is it going down her leg, or is it mainly just in the lower right quadrant of the abdomen, below the navel? Normally, when I'm talking to clients, if you guys are not familiar with trigger point therapy and the science behind it is maybe not holding up to scrutiny. I used referred pain patterns all the time in my practice. So GSS, I'm going to get right back to that in just 1 second. So, oh wait, I forgot what I was going to say. I totally got blanked out. Pain on the right side, huge knot in the shoulder blade, working on breathing. Oh well, it's gone, whatever it was. So when you talk about having a huge knot around your shoulder blade, is that in the posterior? So ilk apt root, when you talk about the over-the-counter meds can lead to damage in the intestinal lining, I think that most doctors will recommend that you take non-steroidal anti-inflammatory medication at a very limited dosage for limited amounts of time because of that. If you take it occasionally, I don't think it's as big an issue. Yeah, relax. If they're having issues right in the center of the navel, listen, in addition to this, I want you to go in with the heel of your palm right on top of the navel. You can reinforce with the other hand. You're not leaning in aggressively. You're not being malicious. You're not being aggressive. You're not being mean. You're going to hang out and get them to breathe and see if you can press into that area. I want you to gently shear to the left or the right and give them a choice. Say what feels more engaged, what feels more pleasurable, what feels like, oh, right there, I'm getting some relief. Then I want you to do the same up and down. That shearing motion feels like you're engaging nerves through that area to try to hopefully deliver a unique input into their nervous system that hopefully their body will respond to with pain relief. I have a client who has a very bad SI joint problem, and I've been doing lots of abdominal work with her. She wrote me a message earlier to tell me that she had a little bit of spotting afterwards, meaning that her internal organs are probably affected related to menstruation. And she also said that her digestion had greatly improved. Any issues that she was having, I think we were possibly facilitating peristalsis, which is the movement through the digestive tract. So GSS 1123, if you're having issues along that scapular spine area and it's in the posterior, you can pretty safely use a tennis ball, put it on your back and lay down on the floor and be able to put it in position to lean into that. I think that's possibly going to help you work on some of the musculature related to that. Just tell us later if that actually did help. There's a lot of video I've produced with the Psyche Truth channel doing things similar to that. If you look on my YouTube channel, I've got some additional pieces of like foam roller or like using a tennis ball. It could be a lot of different individual muscles. So like a piece of insight as a massage therapist, a lot of clients will ask me, what muscle is that? And I'll say, I don't know. And they go, what? Like, you're the massage person. You don't even know. And it's like, listen, this one area I'm pressing on is your rhomboids. Okay. It's your paraspinal muscles, which at least are 2 or 3. It could be any of those muscles, and it could just be a muscle from vertebra to vertebra that's part of your rotatories. Like, there are like 5 layers of muscle right here. I've not been able to determine what muscle I think it is specifically. That's where the job can be inordinately complex. Indy Miro, when you talk about having a lot of pain in your left knee, where on the knee do you feel pain? Is it on the inside of the knee? Is it on the outside of the knee? Is it below the kneecap? Is it at the bottom section of the kneecap? Can you give me more information about that? So relax. If you search on Psyche Truth's channel, I want you to search for Abdominal Massage and maybe Melissa Lemunyon and find a video with her. It was, to my knowledge, it was the first abdominal video I did with Psyche Truth, if I remember correctly. But that's going to give you a way to get started in softening the abdomen so you can do that little bit more pressure if you decide to. People having issues around their shoulder blades is inordinately common. We're always using our arms and then shoulder blades to be able to lift and mobilize things. They get lots of activity. So it's good to be able to work on those. I work on a lot of massage therapists because I'm a massage instructor, a CE provider, and a client I just had the other day, massage therapist. She didn't tell me Verona, we'll get to plantar fasciitis. Give me just 1 second. That's a good one. I can talk about that at length. She's having problems with her rotator cuff. And the reason she's having problems with her rotator cuff is when massage therapists lean in with a forearm and an elbow, they're using all of these rotator cuff muscles to stabilize their humerus. They're using the tricep. They're pressing in. They're using posterior deltoids. They're having issues with the rotator cuff because they're using those muscles all the time. It's a good thing for massage therapists to get work on those so that they're freeing up motion in their rotator cuff. Now, when we get to plantar fasciitis, Verona Arby. Okay, plantar fasciitis sufferers. I will remind you again that massage therapists do not diagnose or treat any condition. Hey, GSS 1123, thank you for that donation. That really helps us continue doing what we're doing here at Psyche Truth. I really support that, brother. Thank you so much. Verona, when we talk about plantar fasciitis, here's what I see in practice. A doctor can give somebody a condition. They can give them a name for what they're dealing with. So I'll give you another example. Temporomandibular joint dysfunction. So Ben, I'm not the owner of the channel. I'm just a lowly massage therapist and yoga teacher on the channel. So when people are having problems with their feet, I don't know why, because I can't diagnose or treat any condition, right? But sometimes I can help people with symptoms if the symptoms come from soft tissue. People come in, they tell me, I am having plantar fasciitis. Verona, I almost laugh. And the reason I almost laugh is there are certain conditions that I see. Piriformis syndrome or sciatica, plantar fasciitis, carpal tunnel syndrome. I see these so regularly. Thoracic outlet syndrome. I see these so regularly. People sometimes break down crying after I work on them because I'm able to help them so rapidly in pain reduction or symptom reduction. Do you notice how I didn't diagnose or treat any condition? I helped them with their symptoms. When I do that, it's because their issue is soft tissue related. That's what massage therapists do. We're soft tissue guys. When I see people, here's what I see. On your calves, you have some muscles called the gastrocnemius. The gastrocnemius have bellies. Gastrointestinal, gastrocnemius, a belly. The bellies of the gastrocnemius, right? That's what you see when guys flex their calves and they're really muscular calves. You see that split. Underneath the gastrocnemius, you have a muscle called soleus. You also have another muscle, I believe, called tibialis posterior. Some people deep along the tibia and fibula, those are your two lower leg bones. The tibia is the big shin. The fibula is a smaller muscle, a smaller bone inside. When people are having problems with tibialis posterior and they're having problems with soleus, what I find happens is those muscles are shortening and pulling, and I find that they're often getting referred pain down into their feet. So you can have, follow me along real quick, soft tissue. They're having problems. I'll use my forearm as an example. Evolutionarily, this is our upper leg. Make sense? Radius and ulna. What you've got is a situation where the muscles are so tight. When I see people who have carpal tunnel syndrome, they're often having problems with these muscles. It's referring pain down into their hand and wrist. They may not have a clinical case of carpal tunnel syndrome. They're just having muscle pain. Muscle pain is something we can treat. And when I say treat, it's because we're treating soft tissue. We're treating a soft tissue condition or issue that person is having. What that means is if I put pressure into their forearm extensors, into their forearm flexors or pronator teres, I'm usually able to help them down this chain because these muscles are pulling on stuff in here. The same thing seems to happen with plantar fasciitis. You have to go very slow to work into soleus and to work into the gastrocnemius or potentially tibialis posterior, but you can slowly use, in most people's case, a forearm. In my case, I can stand on you because I have a suspension system. I can use my feet, big, broad tools, completely wrap around the calves and give you just enough pressure to be able to sink into that, to be able to work on it. And if the issue is soft tissue related and you've had a muscle in there and that muscle has shortened and that muscle does not let go, if you sit like this for a month and you come see me and you go, my arm hurts, and I go, where does it hurt? And you go, man, right in here to my shoulder. My whole job as a massage therapist is to get your arm to let go and relax. And when people do that, they are absolutely amazed at how much pain relief they get. If you have plantar fasciitis and you are watching this and you're like, well, I can't afford massage. I can't. Well, I got a solution for you. It's called a tennis ball. And here's how you're going to start. You're going to take the tennis ball and put it down. You're going to put your calf on top. The top 3/4 of the junction. And what you're going to do is you're going to lean into your calf. You can use a forearm to lean into it. You're going to apply just a little bit more pressure and see if you get sensation. Now, you don't want it to be painful. It can be intense. Intense is engaged. Intense is like, ooh, what's that? It's got my attention. It's meditating on that specific spot. What I want you to be able to do is apply some pressure into that area and see, do you start to get referred pain down into the area where you feel your plantar fasciitis? If you do get that referred pain, my guess is very quickly that you don't necessarily have a case of plantar fasciitis. Again, I'm not diagnosing or treating any condition. What you're having is a case of tight legs. If we work on that tissue and we soften it and open it up, 9 times out of 10, people's pain will reduce, their mobility will increase, and they will feel better. It may take a couple of sessions. I may have to show them how to work on themselves, but I find lots of people get benefit from that. One of the things I do as an educator is I constantly go back to musculoskeletal anatomy, muscle and bones. And I look at muscles, because I can't really do much with bone, right? It's bone. It's solid. Muscles I can work on. Muscles are pliable. Muscles are responsive. When I traction skin, are you ready, pain science community? When I traction skin above that muscle, I'm accessing the nerves that go to that muscle. I'm sending a stimulus into your nervous system to get your nervous system to respond. You would not believe how many people I have worked with over the years. They just have tight muscles. They don't have a debilitating condition. Their quality of life can be greatly improved just because I can show them how to work on themselves. I talk to massage therapists about education, and they get very nervous about this. The reason they get nervous, they think, is ilk taproot or aptroot. If I work on a client and show them how to work on themselves, they're afraid the client isn't going to come back. And I go, no. The client is going to write a glorious review because you educated them, and you're going to be able to help people. There's more pain and suffering in the world than I can potentially treat, especially when it comes to hands-on. When I give people education, it builds rapport and trust and means they want to work with me. Hisham Muhammad, when you talk about the best position for the neck during sleep, I think it's what makes you most comfortable. One of the problems I see with people in sleeping is if you try to force someone to sleep in a position they are not comfortable in, they can't sleep. Guess what happens when you can't sleep? Whoosh, pain levels go way up. If you are a side sleeper, I really like being on my side to sleep. I think you can use a pillow to put your spine at a neutral position so that your head isn't bent to one side or the other. But some people find it's better to sleep on their back, where again, the spine is at neutral. They have a pillow underneath the neck to support. The challenge is, what if you're a belly sleeper? I see some people talk disparagingly about sleeping on your belly, because at that point, you have to turn your head to the side or the other side. Most people will have a little bit of an imbalance from one side to the other if they are belly sleepers, because their cervical rotation is easier on one side than the other. That's the only thing I can think of. Mostly it's working on the tissue, the muscles around the neck to be able to promote relaxation, calm, and muscles that contract when we need them to. When we continue to talk about plantar fasciitis, listen, that stuff with the tennis ball, I'm telling you guys, if you work on that, you can also take your leg and just reinforce your thumbs and press in. The problem is your hands are going to get tired before you get more deeply into that area, which means like I have tight calves. I use my calves and my feet kind of like their hands sometimes because they work so much. Using my legs and feet, which is kind of odd for a massage therapist. If you press onto my calves, they can be a little tight. It takes time for my body to receive that stimulus and relax, release, unwind. So it feels like I'm sinking more deeply into soleus and tibialis posterior. But you can look those up. I think that's a great way to go ahead and begin working on that. The other part is, and plantar fasciitis would be a good jumping off point for this. I don't often find that people can stretch away pain. I do yoga. I love yoga. I think that yoga increases mobility. I think that yoga promotes calm and relaxation, does really great things for people. I think that yoga is really great for pain relief. I don't think it's always great for specific things. So can you stretch away plantar fasciitis? Sometimes it seems like, let's say this entire part of my forearm was just muscle. What I notice is they can almost have a problem more over here than over here than over here. What I've got to do is I've got to find the tense, tight, dense, restricted area and deliver a stimulus in there. When I find that dense, tight, restricted areas, then it seems like I get more bang for my buck for the time of applying pressure there. The stimulus into that area, that particular nerve that we're accessing through skin stretch, through that compressive force. What I then find is this. Let's say I work on your plantar fasciitis. I find tightness in your gastrocs, in your soleus, in your tibialis posterior. I'm going to hang out in that spot. And then once that stimulation has diminished, once it feels relaxed, you're calm, it feels like it's released, you're going to be able to stretch. Follow me this? You're going to be able to stretch and lengthen through this area. What I often find happens is if they're having a problem right here, it's almost like they stretch around it. Now, I don't have scientific backing for what I just said. I don't have a research study to back that up. It's just my clinical practice working over the years. I don't find that people can as easily stretch this out. One of the things I noticed with the Iyengar yoga, Iyengar would talk about awakening the intelligence. And when Iyengar would talk about awakening the intelligence, I was like, what does that mean? And here's what I think he was really saying. He was waking up their nervous system in that area. Iyengar used props to allow people to do myofascial release on themselves. Now, if you're an Iyengar teacher and you're watching this and you disagree with me, please comment and talk to me and tell me why you think that is not the case. But I kind of live in this American realm. I'm looking at Asian traditions, specifically yoga and Thai massage. I'm hybridizing, mixing, and matching, and then adding pain science and reinterpreting why these things work. Ooh. So I'm going to say glam chica. I think that's what your name is. If you're having a place between the shoulder blades that hurts, it's very concentrated, here's what you're going to do. My guess is most people, their flexors are tight, which pulls everything forward. I want you to lay on your back, potentially over a foam roll, if you have a tennis ball available, from either side of your spine. If this is your spine, you can put the tennis ball on either side. I want you to lay on the side that feels dense, tense, tight. And I want you to try to breathe. If that tennis ball is too firm, by the way, you can fold a towel over it. When you do that, I want you to be able to go ahead and apply pressure that may feel intense but not painful. And what's going to happen is you're going to open up your chest. You're going to open up your rib cage. Normally, when that muscle is hurting, here's what the interesting thing is. You going to follow me, Glam Chica? When I work with massage therapists, I have to sort of retrain them. I have to sort of deprogram them sometimes because they'll go right into your back and start pressing. And I will too. But the problem is, I think the muscles in the front are the issue. The muscles in the front are stronger and they're pulling you forward. What we're trying to do is apply pressure or allow length to be able to open that up so that you can take pressure off that muscle. I think that little muscle in the back, Glam Chica, is fighting. And it's fighting these big guys in the front that are pulling forward. So what I want you to do is just apply a little pressure in there. I want you to be able to gently move around to be able to go ahead and see if you can get that to release, relax, and unwind. Because what you're fundamentally doing is you're sending a stimulus into your nervous system to get it to relax and release. Mark Wilson, thank you so much for being a fan, sir. I really, really appreciate it, Mark. When you guys come on and chat with me, it really helps me out, really helps me build. Again, If you want to find me on my channels, that's Robert Gardner Wellness on YouTube, RG Wellness on Snapchat. It's Robert G Wellness 12 on Instagram. I'm on most social media platforms, including Twitch, if you guys are interested in that. Just go ahead and follow me. I wanted to thank you guys for following me. If you guys have additional questions, I can come back to this live chat later, because I'm assuming this will be on the channel afterwards, like preserved. So I can come back and answer comments and information in here if you have additional questions. Thank you for all your support. And if you have additional questions, if you write down below, if you like and share this with your friends who may benefit from the information there, that's going to allow me to go ahead and give you more information. I can make a list of the questions and I can kind of kick off the next live chat where we go over those. So SRT, or structural release therapy, I don't know about specifically. In the massage industry, there's tons of acronyms. They love acronyms, coming up with new methods. There's only so many ways to manipulate soft tissue. I'm all for brand building. I don't know anything about structural release therapy specifically, but I think fundamentally, from an anatomical and physiological standpoint, it works for a reason. And those are the questions we want to ask. So listen, you guys have a great day. Thank you so much for following me. If you want a little more paid content from me, if you go to rgwellness.teachable.com, I have some information there on Teachable. I have a series of workbooks and videos you can purchase, as well as a subscription service with about 300 hours of my instruction of students, if you're interested in those. Thank you so much for supporting us on Psyche Truth. If you're interested in Psyche Truth and what we're doing a little bit more production in social media on various channels. So please go find Psyche Truth on Instagram, Snapchat, Twitch, all those platforms, so you can follow us. We're going to be putting content that's diverse across those channels, and we really appreciate your support here on the channel. Thank you so much. I really cannot express how much I appreciate your time and energy here, and you guys have a great day. We're going to shut down and we're going to see what else we're going to do here today at Psyche Truth.